businesses coping with COVID-19 in the workplace? Topic of my discussion today with Rob Wilson. He is president of Employco USA. Hi, Rob. How are you doing?
Great, Robert. How about yourself?
All right. So tell me, just in general terms, how do you think that businesses are handling the prospect and the reality of COVID-19 in the workplace right now?
It's been a challenging time as many companies across the country reopened, and sadly, it's not a question of if an employee is going to come down with COVID, but a question of when and what are you going to do as a business to one, to prevent it as much as possible, and two, if it does happen to an employee, how are you going to handle it?
Yeah. Well, of course, one big step is to keep them out of the workplace altogether, and therefore working from home, and a number of workers that's working out for. But we can't do that with everybody, can we? So with workers coming back into the office to the extent that they ever left, how are businesses balancing the need for worker safety with the necessity to keep their businesses afloat?
It's a great question. So a lot of our clients, what they've done is you can institute things like most common few items are taking people's temperatures. And if you don't want to have someone doing the temperature taking, you can get the hands-free. Like in our case, we have one mounted on each of our floors that employees can check their temperature when they're coming in and out of your business.
Immediate results, is that reliable?
Yeah.
You get fast results?
Yeah, you stand about this far from it and it pops up instantly, so it's a touch-free. And as well as most companies are having their employees fill out or complete either online or paper versions of the health questionnaire. Do you have symptoms? Are you waiting a test? Do you know anybody that has symptoms? So that kind of health questionnaire, and most of our clients across the country are utilizing that. For example, we're based in Illinois, but we've got offices all over the country. In the Illinois rule is ours: if you work more than 5 hours, your employees have to do that a second time during the course.
Really? Just like in the middle of the day or toward the afternoon, you got to come up to somebody and say, time for another temperature test?
Right. And same thing with the actual questionnaire.
Wow.
So, but the questionnaire is very common, as well as in their office. So many companies, whether it's an office, a plant, or a restaurant, retail businesses, you're requiring your employees to socially distance, keep 6. Most people are marking the floors, and then reassessing your desk and workplace area. Are you, from a workplace standpoint, do you have any type of physical barriers between people, whether it's plexiglass, so that you've got that a barrier in between, whether it's your receptionist desk or if you've got office cubes. And you're doing that around machinery as well in manufacturing plants.
So are you seeing actually offices like moving desks and spreading things around a little more, getting rid of the cubicles where people were like shoulder to shoulder? You're actually seeing those type of interior redesigns?
Absolutely. And then you're also seeing, if some people need to work in their office and other people can work remote, like you said. Like in our case, we looked at, as and we've helped this with a lot of our clients, as you walk through your office space, where are those areas where their desk is within 6 feet of the photocopier or heavy trafficked areas. And so in our case, in a cube, we've got put up dividers, and then we've also looked at not having all 4 people at the same time. So maybe going some morning, some afternoon, every other day.
Yeah.
And then look at what's your cleaning facility? How often are you cleaning? Do you do deep cleans at all in your office? And then what does your air intake look in your HVAC system? Can you do you have the option within your office building or manufacturing plant to either one, there's you may be able to open windows, and in cases where you can't, is how much fresh air can come in through your air filtration system.
Boy, that is something that very few employers had to think about in the past, is how their filtration and air systems were, especially if you're in a large skyscraper or something like that. You don't really have control over that, I would assume, right?
No, and your biggest challenge too with your large, your office towers that so many thousands of people across America have worked in, is getting up to, you're on the 50th floor, you can only put 4 people in an elevator.
Yeah. I mean, there's no, even 2 people in some elevators are not sufficiently distanced.
Right.
In addition to temperature testing, what about actual virus testing? To what degree do we need to have that in the workplace, and if so, when?
And so most companies aren't mandating testing unless you have symptoms.
Mm-hmm.
But testing is becoming more and more readily available, much more than it was even 2-3 months ago. So some of our clients, you can access it through different medical facilities, some in-home tests, some in-office, in-home testing. And if you do have symptoms, most companies are requiring you to leave the premise and go get tested.
I wonder if it makes sense for those workers who have been working remotely and are now coming back to the workplace for the first time since the pandemic hit to have an initial COVID test at that point, at least. Do you think that some businesses are seeking that just to start out?
I think they are, and especially as you're coming into you're seeing a wave increase in certain cities. You're seeing more and more people with testing being readily available, asking for more testing. And then, it's a whole nother issue if you find out that someone is positive, what you have to do.
What does an action plan, assuming we got to have something like that, consist of in the event of an employee testing positive on the job? What do you need to keep in mind to make sure that you act swiftly and humanely or whatever, and that you have that plan ready to go?
And so you should. We've created a plan for our clients, and happy to share it with you as well, and with a number of different links on the what ifs and what to do. So if someone does test positive, you need to ideally one, they should leave immediately and go get tested. And if they are test positive, you need to see who came in contact with them, and you have to look at, does anyone else have symptoms? Were they if they were in close proximity, 6 feet, for more than 15 minutes.
Oh, you have to go through the person's whole day or like the last couple of days. How does anyone remember where they were in the building and who they were standing next to? That must be difficult.
Yeah, and so and in those cases, you're asking those people to self-isolate for up to 14 days, and as well to get tested. You also have to look at cleaning, do a deep clean your whether it's an office, a plant, a restaurant. If someone does test positive, you should do a deep clean to make sure and ideally, CDC says best practice is if someone is positive and you close down their area, you should wait 24 hours before you do that deep clean of the surfaces. Just
to give, don't even go there with
the thought of or as long as possible, because the CDC's thought is that let the droplets drop down, so that if anything is airborne, it gets down and then do that deep clean, disinfect all your surfaces, make sure that the soap or cleaning materials that you're using meets the EPA standards for COVID or for SARS.
In the event that a worker does contract the illness, how can you determine whether it was work related?
That's a great question, and for so many businesses, that's a big issue, because as you're in San Francisco, in California, like Illinois, most those two states in particular put the onus on the businesses, because they're saying it's workers' comp related. So unless you can prove otherwise, so you really need to look whatever you can do from a contract tracing. Ask the person, do they have any other relatives? Do they know anybody else that had it? And so, and that's where we're seeing most of our clients that have had it outside of home healthcare. Most of our clients that have employees that have tested positive typically have a relative or somebody else that has been positive.
And so that tells you that it wasn't, they didn't get it on the job.
Right. And if no one else is tested positive in your facility, so you just want to make sure you keep really good records. And something else to think about too, when somebody tests positive, you really, it's still, it's a confidential issue. So you can't, hey, Sally has, because you've got to look at the ADA and the FML. There's a number of issues from an HR standpoint that you don't want to.
But that's almost an impossible task, an impossible balance. Because on one hand, you do want to ensure worker and employee and human privacy. On the other hand, people need to know if they've come in contact with somebody who's infected. So how do you balance that?
Right. And so, ideally, because of the Americans with Disabilities Act, which this falls under, that you don't want to name, you can refer to someone in your department, and people are going to know.
Yeah.
It's going to find out. People are going to find out. But you just, best practices, you want to avoid but any potential case coming back against you as the employer, with the person saying, well, you told everybody and now everybody, nobody wants to talk to me. What are you discriminating against? So you just have to be careful.
Is remote work here to stay?
I to a certain degree, we're in the HR business. We process payroll and a variety of other services. We've always been in person, and we went remote pretty quickly, and didn't miss a beat. But now I've got a third of my office doesn't want to come back. They like working from home. So,
Well, I mean, it's also up to the executive to decide whether that makes sense for their companies, whether actual physical human contact is important. Many companies seem to feel that it is.
yeah,
But maybe we won't even be able to determine that until the coming year when things settle down a little bit. I don't know.
right.
Well, Rob Wilson, that is some great advice for how businesses can be addressing this whole very thorny issue of COVID-19 in the workplace today and how it might look going forward. Thanks very much for being with me today. I really appreciate your input.
Thanks for having me.